name is Zach Marslick. I'm going to be your nurse today. Today I'll be teaching you how to inject, store, and mix your insulin properly. So, do you have any previous knowledge of insulin?
All I know is that people with diabetes need insulin.
That is correct. People with diabetes have a deficiency in insulin, and insulin allows the glucose in your blood to move the sugar or energy in your blood, that's what your body uses for energy, to move into your cells to be used as energy. Today we have NPH insulin and regular insulin. They mix these because as soon as your regular insulin starts to wear off, the NPH insulin will start to peak and take action in your blood. So, do you have any questions?
No.
Alright. The first thing you need to do when injecting insulin is to look for the expiration dates on the bottles. This right here, September 1st, 2018.
Wow.
So this is still good.
Lasts a long time.
Yes, it does. And this one is 2018. So these are still good. When your bottles are not in use and you have not taken anything out of them, you're going to want to store them in your refrigerator. And then once you have taken some of the insulin out of it, you want to keep them for approximately 28 days and then throw them out if there's still some in there. It's also important to contact your doctor if you are running low on insulin to ensure that you always have an adequate supplies when necessary.
Alright.
Any questions?
No.
Alright, so the first thing that you want to do is to grab your NPH, the cloudy insulin, and you want to mix it. You have to mix it by rolling it. If you shake it, it can alter the effectiveness of the insulin, so it's important that you always roll it. Alright? Then, we're going to want to open up our needle.
How long do you roll it for?
Just about 15 seconds, 20 seconds, until there's no, sometimes there'll be powder in there, in certain ones, and then once the powder's gone. Alright. Open up your needle. And each black line here, you can see, is 1 unit. You can see that.
Mm-hmm.
So there's 100 units in the whole thing.
Alright.
And for our practice, we're going to be drawing up 15 units of the NPH and 10 units of the regular insulin. Alright?
Sounds good.
First, to be clean and keep you from infection, you're going to want to take an alcohol pad and wipe the tops of the insulin bottles, vials. Alright, got that one. I got that one. And then you want to take your needle and be careful not to poke yourself with these. So you're going to slide off the cap and see the needle. Set the cap there. So first you need to inject air into the vials. So you do this by drawing up the amount of the drug that you're taking out. So we said we're taking out 15 units out of the NPH. So you want to draw the air back to 15. You see how it's at the black marker at the 15? Alright. Then you want to keep it here and then push it through and inject the air into the cloudy. You always inject the air into the cloudy first, and then we have cloudy before clear when injecting the air, and then when we take out the drug, it's going to be clear before cloudy.
So why do you have to inject air?
Because it makes it easier to withdraw the medication when you're pulling out, unless the suction makes it difficult. Alright, and then we have 10 units for the regular.
Alright.
So, since we're going to be drawing it out of this one, there's a top. You gotta carve off the top. And then we're going to stick it in there. And since we're going to be taking it out of here right away, push it in. You flip it upside down and draw out your 10 units. You can draw it a little bit past it for the your first withdrawal. See how I drew it to about 11 or 12?
Mm-hmm.
Because then you withdraw it, and then
Flick out the bubbles.
Yes, good job.
Thank
You flick it. See how the bubbles went to the top there?
Mm-hmm.
And you push it. Alright, and see how we're at 10 now?
Cool.
Alright. And when you withdraw it, you want to turn it upside down so you don't get air when you're withdrawing.
Mm-hmm.
So we're going to inject into the cloudy now. And then, since we're drawing 10 of this one and 15 of this one, you're going to get 25 total. So now we pull it back to 25. Alright. Still no air bubbles. And we're at 25, correct?
Yep.
Alright. And now that you've had the medication in here, you're going to want to recap it so you can prepare your skin for the injection. And you don't want to pick up the cap and put it on unless you poke yourself, and then you're at risk for infection. So you're going to want to use the scoop method and put the cap on the table here and scoop it up. And then you can push it down.
Awesome.
Yep. So now it's time to inject the medication, insulin. And when you inject insulin, you can do it usually you want to do it in your abdomen. Your first part you're going to want to do it in your abdomen.
Okay.
Then you can do it in your arm or your thigh or your buttocks. But when you do it, you want to make sure to rotate the sites that you inject it, unless scar tissue can build up and make it decrease absorption. So you go like 1, 2, 3, 4, like each day.
Just rotate. Okay.
Yeah. And then you also want to avoid scarred areas. Alright? You got any questions?
No.
So I'm going to demonstrate it on this orange. So you're going to wipe it off with the alcohol pad. And when you go in with the needle, you're going to want to go at a 90-degree angle. But if it's in a skinnier person, they go between 90 and 45. So you're going to want to inject the whole needle in to the skin. And then press it down. Alright. And then you wait a little bit, like 5 seconds. And then take it out at the same angle. Alright. Alright. So, are there any questions about the process? And then you want to recap it using the scoop method. Scoop.
Now, what do you do with
the needle?
Needle.
You're going to want to dispose of it in a sharps container. That's a good question. Alright, do you want to try? Do you remember everything I told you? It's kind of a lot.
It's kind of a lot.
We go through it step by step with you.
Alright.
You want to try?
Sure.
Alright, so what are the things that you need? I'll quiz you.
Okay, you need a
Alcohol
pad. Another little alcohol pad. Isn't that what that little one is?
Yeah.
Then you need to wipe off the top, two tops, and then you get your needle out, and you draw, and you shake this one, or not shake it, but do the roller thing.
Make sure just roll.
So go like this for 10 seconds.
Yeah.
That's not 10 seconds, but there you go.
You don't need to go that fast because I'm shaking it.
And then, so then you get your needle out. Do you care if I do it?
Well, do you want to overview it and then you could do it all together?
So you get your needle out.
Yes.
And then you pull out 10 from here, from the bottom.
Oh.
Wait.
Try to do the air.
The air, yeah. So you push in air for both of them, or for this one.
Yeah.
And then flip it over. Draw out 15.
Out of this?
Okay,
First you have to inject the air into here.
Okay, so
remember when we're drawing clear before cloudy? Think C, the clear and cloudy both start with C, but the E comes before the O in cloudy.
Oh, that's a good way to remember it.
So that's how I remember it.
Okay.
So you inject air into here, then air into here, and then clear before cloudy when taking it out.
Okay.
Alright.
And then you take 10 of this. clear,
Yes.
and then you can take like 12 and then push it up so the air's out
And flick it.
and flick it.
Yeah.
Yep. And then you do 10 or 15 out of this, so it equals 25 at the end. Flip the air out, and then you take your patient or demonstration, and you hold it at a 90-degree angle. Push it until the whole needle is in, and then inject and pull it out at the exact same angle. And if there's residue, then it's not that big a deal. You just wipe it away.
All right, and also when you do it, I couldn't do it on the orange, but when you do it in your abdomen, you want to pinch some skin up.
Okay.
Because it goes into like the fatty layer of your skin, so you don't want it to like go through into the muscle. So by squeezing it up, it gives you more.
Awesome.
All right, you want to try it?
Sure.
There's your patient, your abdomen, since it's you now.
Okay.
So,
your thing, wipe it off.
yeah.
Wipe it off. Probably the other side. It doesn't really matter. Okay, and then get your needle out. Take this off. So you inject your...
Don't forget to mix your NPH. Yeah, there you go. But if you do that, make sure you recap the needle, because you don't want to be...
while you have it in your hand. Okay, there's one.
All right.
And then, so first you take out 15 of air.
Yep.
Push that in.
Yep.
Get me to do it. Okay.
All right.
And then you take 10
10, yeah. Or whatever your
of the other
order
one.
is.
Push that in. And then then you will first you take out 10 of this.
Yes.
You have to flip it over.
So you don't necessarily need to take out the needle after you push in the air. It just makes it easier.
Oh, okay. So push that in. Take out about 10, a little bit over, so you can get the bubble out.
Yeah.
Pull it out. Flick it up. Make sure you go to 10.
There you go.
And then take this one, pull it over,
Okay.
push it in. Take out 25 because you already taken out 10.
10, yeah.
Where's that 25 mark at? There it is. Take a little bit more so you can flick out the end. Push it out. Okay, there's 25. Then you take your thing, 90-degree angle. Push it in at 90.
Pinch if you could.
Oh, pinch,
Yeah.
yes, if you can. Push it in. Inject. Pull it out, same angle.
Mm-hmm.
And then, that's done. You use the scoop technique. Scoop up your cap. And dispose of it in a sharps container.
Very good. Are there any other questions?
Seems pretty basic.
You feel confident that you could do this?
I do. You did a very good job explaining to me.
All right. And here's some information that you could take home. Please call us if you need any assistance or a little review.
Cool.
All right.
Thank you very much, sir.
Thank you.